Well, good evening, everybody. Mike Rounds here. Thank you for hopping onto the line and participating tonight in our live Tele-Townhall to discuss COVID-19, also known as the coronavirus. This evening, I am joined by my colleague, Senator Bill Cassidy of Louisiana, who is a doctor. He is a gastroenterologist, and he is going to be helping answer some of the questions that we may have this evening. And Doc, thank you very much for joining us. Now, we look forward to answering questions from all of you on COVID-19. And so if at any time during this next hour you would like to ask a question, all you have to do is just push *3. And again, if you push *3 anytime during the hour, it'll bring you up with one of my staff members. And at that point, we'll get you into the queue. Now, we really want to do our best to answer as many questions as possible and go through as many issues related to COVID-19 as we can this evening. So if you want to ask a question now, remember to press *3, and you'll be connected with a member of my staff. Now, while we wait for a few questions to load up, I just want to make a few really quick remarks, and then I'm going to let Senator Cassidy say a few things as well. As a nation, we're all feeling the effects of this unprecedented crisis. No one is immune to not only contracting the disease, but from feeling the effects of its rapid spread. From classes being canceled for students, to many individuals teleworking, to businesses closing shop, and all of us socially distancing ourselves from our loved ones in many cases. This has been an adjustment for almost everyone. Our first and foremost immediate concern is to keep everybody healthy and safe. Now, we're also working as lawmakers to make sure that people have the tools they need to weather this storm. We did pass the CARES Act last month. It's about 2 weeks ago. And now we're working to make sure that South Dakotans understand how it will impact them and how to help families and businesses use the tools outlined in this legislation effectively. Everybody is hurting, and we want to help relieve that pain as much as possible. In South Dakota, we have 393 confirmed cases as of this afternoon. And yet at the same time, we have not been hit nearly as hard as some other places, such as Senator Cassidy's home state of Louisiana. Doc, if you'd like to say a few words about what you're seeing, both as a medical professional and as a Cajun who is currently experiencing one of the highest rates of infection in the United States, I'd really invite you to say a few words right now, Doc. Thank you.
Hey, thank you, Mike. First, let me say it's a privilege to be with you all. Mike Rounds is a fantastic senator. We came in at the same time into the Senate. He brings a perspective of being a former governor, having a great deal of experience with insurance. It always comes to bear. I thank you all for sending Mike Rounds to the United States Senate. He serves your state. He serves the entire country. Mike mentioned I'm a doctor, a gastroenterologist. My laugh line has always been that gastroenterology prepared me very well for politics. And I chuckle a little bit, and I say, if you're over 50, you get the joke, or at least you better. And if you're under 50, you don't, but just you wait. But on the other hand, in my medical practice, I also did public health programs, vaccine programs, which exposed me to a lot of issues regarding immunity. How do we build it up? How do we get immunity? And that sort of thing. And trying to use that to come up with public policy that will benefit our country as we fight off this coronavirus epidemic. So I look forward to your healthcare questions, and on my own town halls, I answer all the questions, but here I'm going to give Senator Rounds the non-healthcare, and Mike, if you give them to me, I'd love to answer the healthcare.
Great. Thank you very much, Senator. And once again, I really appreciate working with Senator Cassidy. He's one of these guys that brings a huge amount of compassion and passion to the United States Senate. He's become a very good friend. And a lot of us have come to rely on his thoughts and wisdom when it comes to our health care, among a lot of other issues. Now, at this time, I'm going to say it again, *3 if you'd like to ask a question, and that'll get you into the queue. We've got questions coming in right now. And the first one is from a lady. Now, this is an online question, so I'm going to read it. This is from Alexis. And, Doc, this is one that I think I'm going to have you answer. How long does coronavirus live on surfaces?
That is a great question. First, let me describe just a little bit about the coronavirus so you'll understand. A virus is not a bacteria. It's just a set of RNA, and it's surrounded by a little sheath of fat. And that fat is what protects it. By the way, that's why washing hands is so important, because the soap dissolves the fat. And if it sits on a surface, slowly it dries out, that dissolves the fat. When the fat is gone, the rest of the virus dies. So now to the specifics of the question, it can last about 3 hours on fabric, about 4 hours on copper and wood. Wood kind of dries it out, and copper has a little bit of an antiviral effect to begin with. It can last up to a day on cardboard, 2 days on, say, stainless steel, and 72 hours or 3 days on plastic. Of course, it depends. If you have a little bit of spit that comes out of your mouth, it lands on something and dries out, then the virus will dry out and it's gone. But if you have a big sneeze and a lot of mucus, with a lot of the virus in the mucus and a lot of moisture in the wad, if you will, then the virus is going to be able to last longer. That's why hopefully you are doing what I'm doing. If I'm going out to a surface that's outside my house, I put some Lysol wipes in a little baggie. I wipe everything down, bring in my hand sanitizer, wipe my hand sanitizer, my hands with it, just making sure that all those surfaces are clean.
Great. Thanks, Doc. As I look over here, we've got hand sanitizer sitting on the table where I'm at, and I've got a little 3-ounce thing of hand sanitizer in my pocket as well. Okay, you're not going to get off the hook that quick, though, because I do have a second question, which is online right now. This one is from Andy, and the online question is it safe to go to a hospital or a clinic for a reason other than coronavirus if it is not urgent?
So that's a great question. My governor, because we've had such a problem, has requested that we all shelter in place, meaning only go out for essential, like pharmacy issues or having to go to the grocery store. That's the current recommendation because we've had such an outbreak. But I'll tell you, my doctor friends will speak about, wait a second, I know a patient who's due for skin cancer surgery. It's not emergency, but it's got to be done. How long do you want to wait? A gastroenterologist friend told me, I had a patient call me up and they were having rectal bleeding, so bleeding out of their, in their bowel movement. Not an emergency, probably, because there wasn't a lot of blood, but the patient still wants to know what it's about. So I think it's kind of, you got to figure out what's the relative importance of what you're going to see. If it is a routine visit for blood pressure, take your blood pressure in the pharmacy, call the doctor, and she or he will say, oh, your blood pressure is okay, don't bother about it. If it's for your diabetes and you're checking your diabetes stick at home, then frankly, probably if you're doing well, just call them up, give them the numbers, stay at home. On the other hand, if you're having, some of the problems I just described, they're not emergent, but they're not really routine. Call your physician, get the word, see what she or he decides. One more thing I will say, many hospitals have it set up. If you have symptoms of coronavirus, you go in one direction. If you have symptoms that don't appear to be related to coronavirus, you go in the other direction. That way you don't get infected with coronavirus. So also check with your physician. Lastly, I will say, I would also follow the CDC recommendation, wear a mask when you go in. You can make one out of a T-shirt or a bandana. Just wear a mask just for belts and suspenders to make sure you don't get infected.
Okay, Doc, thank you. Well, I think I'm going to give you a break. I've got Scott Vanderwall, who is president of the South Dakota Farm Bureau. He's on the line with us. And, Scott, you've got a question for us this evening.
Good evening, Senators. First of all, thank you for being with us. I appreciate your attention and talking to the citizens. I've got a question from the agricultural perspective. And first of all, I'll start out by saying the Paycheck Protection Program is something that's appreciated. At least we think that most farms and ranches will probably qualify for that if they choose to try to do it. But just like anything else, there are unintended consequences. And when you think about the markets that we've seen in agriculture, the cattle market has really taken a dive. Corn is down $1 a bushel. We're seeing net income prospects for this year just really, really turning red. And this is the time when people should be going into their banks and staying in contact with their loan officers. But because of the Paycheck Protection Program, the banks are absolutely 100% consumed with that right now, to the point where you can hardly even get your banker to answer a telephone call. So my point is, I would encourage you gentlemen to use whatever resources you have to help the federal government streamline that program and try to make it as efficient as possible so that they can get that done and get on with some semblance of normal business.
Hey, Scott, thank you. And rest assured, right now, I think there isn't a single member of the Senate that would disagree with you. This has been 7 days a week for the last 2.5 weeks now. And the PPP, or the Payroll Protection Plan, really has become the most popular part of this. And you are correct, Scott. I think that there's a lot of our ag producers that will probably qualify. They need to talk to their lender. Their lender is going to say, look, I'm just full up here. Give me a couple of days. I would say get in line with the lenders. A lot more information is coming from the SBA just in the last 4 or 5 hours. In fact, they just went through about 18 critical questions that they've now answered that a lot of producers were asking yesterday. And you are right that they are absolutely filled. Thousands of small businesses are trying to get involved. We did put $350 billion into this to begin with, and we have indicated that we are prepared to add an additional $250 billion immediately. We know it's got to get through the House and the Senate, and that means politics are involved. Some of our Democrat colleagues have already indicated that they're not ready to let it go through yet. They want to add a few things in. That's got to be negotiated out yet. But right now, for ag producers, in addition to the PPP, we were able to put in about $24 billion additional that should go directly in for ag producers. Now, part of it fills back up for the market facilitation plan because we lost all those markets in the middle of the trade war. But we also put in $9.5 billion of that to be directly used and including livestock producers as a result of this COVID-19 mess that we're in the middle of. And I know that Sonny Perdue, our Secretary of Ag, is working very hard to put together the plans on that. So hopefully, not only will ag producers get a shot at the PPP, but they're also going to see a shot from the Commodity Credit Corporation plan, recognizing the losses to the livestock industry as well. So hang in there with us, Scott. We got a couple of rough weeks ahead of us yet, but hopefully this is going to pay off, and we're going to be able to see some of these guys survive and start to see a little bit of sunshine just coming over the horizon. Thanks again, Scott. Okay, I've got a question here online from Terry, and Terry had a question, and Doc, I'm going to ask you to answer this one for me. She's talking about the medication, the chloroquine, and she wants to know what's the thought process on this. We know that the president has suggested, there's no reason not to try it, and I think it comes out as a hydroxychloroquine. Can you talk a little bit about what this is? I understand that it's been around for a long, long time, but what's the thinking on it, and what's your advice in this particular case?
Yeah, well, first I'm going to tell you, before you take it, speak to your physician. And for those who just joined the call, I'm Senator Bill Cassidy from Louisiana, great friend of Mike Rounds, and he gave me the privilege of joining y'all tonight. So the hydroxychloroquine is a medicine that, say, right now, folks who have rheumatoid arthritis may be taking. There is some people who believe that if you take it routinely, it actually is a prophylaxis against getting COVID-19. And there's different studies that are out there, for example, that if you look at patients with rheumatoid arthritis, maybe they have, who are taking hydroxychloroquine, that maybe they have a lower incidence of COVID-19 than you would expect. Well, that's very promising. But the medicine has side effects. So I saw one place, I forget where, had started to give it routinely, then they backed off because some of its side effects are heart arrhythmias, which obviously can be fatal. But that said, there's many hospitals that have already started using it. When somebody comes in an early disease, they start it along with an antibiotic. Now, I'm giving you both sides. There is evidence that it appears that it works, but it can have side effects. And although there's evidence that it appears that it's worked, it's not definite. Tony Fauci, the NIH person who gets up there and speaks, he really thinks that we should have proof that it works before we use it routinely. I can tell you there's a lot of doctors that are saying, the heck with that. Since I don't have many options, if this is the one option I have, I'm going to use it. What I really encourage you to do is to speak to your physician. Should it come to the point where you think you've been exposed or maybe have an early case, then your physician will be able to say, well, listen, I think you could take it. There's no risk of side effects. Let's try. Or he may say, you've got a heart problem, and you've got this heart problem or else you got this lung problem. I really don't want to take a chance because the side effects may outweigh the benefit. So have that conversation with your physician when the time comes, and you kind of weigh that risk benefit.
Okay, and thanks, Doc. And the one thing I would add to that is first of all, don't go walking into the office until you call first, just to make sure that we don't spread it if you've got it, and let them be prepared. But then also, to everybody else out there, if you want to get in on this conversation, press *3 and we'll get you into the queue, and we'll get a chance to talk to myself or my friend Senator Bill Cassidy, a Cajun from down in Louisiana who is also a doctor and a trusted advisor. With that, I have Hoffman from Madison. Got a question for us?
Right, yeah, I'd like to know the correlation between normal flu deaths and how many have been actually added on with the virus. So we got a good idea of what's actually happening. I can never get an answer on that. Thank you.
You mean kind of like, how does this compare with a typical flu season and whether or not it's worse, better, and so forth? Okay. Doc, you want to give us a shot on that? Compare this with flu?
Yeah, I sure will. There's several things that people bring up about the flu. Why is this different than the flu? So we may have anywhere from 10,000 to 80,000 deaths, 80,000 in a bad flu year, 10,000 in a not so bad flu year. But typically the people that die from the flu are newborns. Their bodies have never seen flu before. They're not prepared for it. Or they're people who are 85 plus, whose immune systems have kind of got worn out by age. Why is that? Well, as many years as you've been alive, your body's been exposed to the flu, either by a flu vaccine or by getting the flu. So whenever you get this year's version of the flu, your body kind of has a whole library of immunologic response. It pulls off the shelf, it deploys it, boom, knocks that flu down. You may have some symptoms, but you get over it. Now, the crazy thing about COVID-19, in the entire 3 million history of mankind, as best as we know, our bodies have never been exposed to this particular coronavirus. Pretty amazing. 3 million years, we've never been exposed. Our immune systems have no library of response. That virus sneaks in, sucker punches our immune system, boom. Now, we're guesstimating that there'll be 100,000 or so deaths, maybe less, from coronavirus. But they're not just the newborns or those who are over 85, although they are at risk. It's also people who are younger. For example, John Prine. I remember going to a concert of his when I was in high school. He just died at 73. Boris Yeltsin, the Prime Minister of England, is in the ICU with in London with coronavirus.
Boris Johnson.
Boris Johnson, yeah, not Yeltsin.
Yeah.
Johnson, thank you. So there's a lot of younger people who are being affected, and even people who are as young as in their 30s. So whereas the flu is typically the extremely young or the extremely old, coronavirus is getting a lot of people in between, and that's what makes it more dangerous.
Okay, thank you. Now, I do have Michelle from Sioux Falls on the line, and she's got kind of an interesting question here regarding the coronavirus. Michelle, would you like to ask the question directly?
Yes, thank you, Senator Rounds. I guess maybe the question would be directed for Senator Cassidy. We're curious as to why are COVID deaths being recorded as a COVID death if it's not the primary cause of death? So we're kind of curious, are people dying because of the COVID or with the COVID?
Well, it depends on what. So, for example, the cause of death might be respiratory failure secondary to ARDS, or acute respiratory distress syndrome. But they wouldn't have the ARDS, the ARDS, the respiratory failure, if they didn't have the coronavirus infection. So it may be that the top line on the death certificate reads ARDS, and the second reads coronavirus. But really, it probably should read coronavirus and second ARDS. That's just the way these things are built. Similarly, there's a lot of diabetics who are having big-time problems, and hypertensive. If you got diabetes or hypertension, obesity, you're at much higher risk of a coronavirus infection. And so it may be that your cause of death is linked to your diabetes, but diabetics don't normally die in their 50s or in their 60s, and they are with this coronavirus. And so really the only reason they're having the problem is the coronavirus. Now, by the way, if you get in a car wreck and you have coronavirus, the cause of death should be car wreck, not coronavirus. But if you have respiratory failure, even if they put respiratory failure first, you wouldn't be in that respiratory failure were it not for the coronavirus.
Great. Thanks, Doc. Okay, now, folks, if you'd like to get in on the conversation here, press a *3. If you hit that *3, that'll take you right to one of my staff members who will get you in for a question here. Now, I've got Kathy from Sioux Falls, and Kathy has a question about the payments that we've got coming in. Kathy, go ahead.
Oh, no, thank you so much. Mike Rounds, I've been praying for your wife also. Anyway,
well, thank you very much.
Yeah, I want her to be well. My question is, I'm over 65. I'm retired. But I still can work, except for I have not had any hip surgery for my hip, so I'm not able to work right now. However, with the stimulus package, they're going to send me money, which I think is supposed to be a loan, which I'm not asking for a loan. I'm trying to live off what I have, which my husband's a trucker. He's still working. But when they give me this money, if I don't use it and I pay it back to them, then I'm going to have to pay them interest on something that I'm trying not to use. I'm going to pay them back more money than they're giving me. I don't understand why.
Kathy, I have to ask you a question. Are you thinking of it as a business, or are you thinking in terms of you personally receiving money through the stimulus package or the relief package, not through what we call the business portion of it, just the ones that are coming directly out to the individuals?
Right, directly the $1,200.
Let me share with you what the guidelines are on this, because I think I've got some good news for you. Okay. First of all, part of the package, in addition to what we call the payroll protection plan, there is a series of direct payments that are coming out from the Treasury directly to individuals themselves. And the amount, if your payroll, if you're a husband and wife together, but you don't have any kids at home, you would get $1,200 for each one of you, for a total of $2,400. But then if the two of you make over $150,000 per year, it is gradually reduced so that if you're between $150,000 and $200,000, that basically goes away. So if your combined income in the previous year was basically less than $150,000, you will receive from the Treasury a check for $1,200 each one of you, for a total of $2,400. That is not to be repaid. That is a grant directly out to help get through the COVID-19 economic impact. Now, to receive it, it would, if you filed your taxes online, then the IRS has the information on how to get the money back to you, because anything that came back would have gone to a checking account that you would have delivered to them so they could make a direct deposit. If you have never done a direct deposit with the IRS, then they have to have a way to get the check to you, and that would take more time. So for individuals out there that have filed online and they've had a checking account where the money's been delivered back by the IRS in the past, the good news is beginning next week, they're going to start sending those checks out. So that's good news. Hopefully that's what you wanted to hear. Okay, thank you, Kathy. I appreciate that, and we wish you the best, and thanks for those prayers. Now, once again, if you got a question for us, *3, and that'll get you into the queue. Now, I've got Donna from Watertown. Donna, would you like to ask your question directly?
Yes.
Good evening.
Good evening, Senator. Yes, I am. Well, right now, Watertown has 12 cases. And of course, and my husband, we stay home. We only go to the grocery store and stuff like this. But what I was wondering about is when it comes to the masks, even though we have a low amount of people, should we still wear masks when we go out into the stores or anywhere?
Good question. Dr. Cassidy, Senator Cassidy, would you like to respond?
Sure. Again, Bill Cassidy, for those who just joined, and I'm a doctor from Louisiana, and I have the privilege of working with Senator Rounds in the U.S. Senate, and thank you all for sending him. If you go to the store, I would wear a mask. Because I look at those pictures, and granted it's a small town, so maybe you know something I don't, but you're going to be speaking to the person you're paying, at the cashier. You're going to be not 6 feet apart from them. You're going to be 1.5 feet apart from them. And it does seem as if the droplets can go out 3 feet or so. You might say, well, they don't have any symptoms. Turns out 50% of the people who are infected never have symptoms. They are infected, they spread the virus, but they never have symptoms. They may be working and nonetheless be infected and spreading it to others. So I hate to shop, but my daughters love to get out. So they do wear masks when they go to the local grocery store and to the pharmacy. Now, when my wife and I walk, we don't wear masks. We're able to stay 6 feet from other people. We're outside. There's really a low risk. So the smaller the room, the more likely you're going to be infected. The more open the space, the less likely. So if you're going to be in a relatively small place or within 1 or 2 feet of another person, then I would recommend that you wear the mask.
Thanks, Doc. And I think the other part of that, for a while, we were really trying to save as many of those masks as possible for the healthcare professionals and so forth. And now a lot of folks are making homemade masks and so forth, and we're not taking those from healthcare professionals. So, Michelle, thank you very much for that for that question, and we appreciate your calling in on it. Now, I do have Michelle from Sioux Falls on the line as well. And Michelle, would you like to ask your question? Hello, Michelle. Did I lose Michelle?
Hi there.
Oh, hi, Michelle. Are you there?
Yeah, I'm here. Can you hear me?
Yes, I can. Go ahead with your question.
Okay, I work at a local hotel here in Sioux Falls. We actually have our pool still open. We have about 27 people per night around, and I was wondering if it's still safe to have the pool open, even we drain it and clean it every 2 days.
Very interesting question. Doc, I'm going to dump this one on you. What do you think?
I would say call your office at your State Department of Public Health, which I know former Governor Rounds can tell you exactly who to call, because they're going to have a recommendation on that. I know that typically they've asked that people not congregate in gymnasiums and workout places and swimming pools. And I don't know if that's just because they don't want people to congregate or because they're afraid that the virus may live on a surface. So your State Department of Health is going to have a strong recommendation on that. And Mike, I think we should probably defer to them.
I agree, and I think you're exactly right. And our State Department of Health is right here, but you'll probably find there within your own office, the State Department of Health has probably put a notice near the pool as well. But let's do this. When we're done, I'm going to ask her to call back in, and we will get her in touch with the right folks here at the Department of Health to make sure that we get her the right answer. Okay? Thanks. Appreciate that, Doc. Okay, now I've got Joanna, and she's in Aberdeen, and she says she gets to work every single day what health precautions can she take? Joanna, do you want to kind of explain that a little bit to us here?
Yes.
Joanna?
Hello. First of all, how you guys doing today? I'm glad you guys well and able to have this conversation with the citizens of South Dakota.
Absolutely. No, we appreciate it, and we're glad you decided to participate with us.
Okay. Now, I have a two-part question. My first question is, I work at Demcota Beef Ranch, and what we do is we slaughter cows, and we employ over 800 people. So I'm in contact with these people daily. I can't afford to quit, and I don't want to lose my job by calling off. I'm asthmatic. But my question is, what type of safety tactics can I take in this type of situation?
So you're really kind of looking for what precautions you take.
And for the senator, my question is, why, if this is a pandemic, and why is it that people are saying that you shouldn't be gathered with 10 or more people, but yet we're still forced to work in an environment where there are 800 to 900 people? It doesn't sound safe, and I just feel like they don't want to give us no time off. It doesn't make sense. And I've called I called the mayor's office. They said that it wasn't up to them. They can't just close the facility. And I did all I did all the research and called all the people I should call. So I had an opportunity to speak out. So I was just speaking out to see what kind of conclusions do you guys have.
Well, thank you for your call in on it, and we'll see if we can't answer the questions. I'll try to take the second one, but Dr. Cassidy, would you like to take the first in terms of if you are working in a critical area like that where you're still working, what you would expect would be good safety precautions a person can take when they're around a lot other people in their work?
Yeah, so a couple of things. Obviously, you're in the food supply. Thank you very much for doing so. Food supply are critical workers, be they farmers or ranchers and everybody in between that farmer, rancher, and my plate. And so thank you for that. The kind of precautions being given to people who are still your essential workers is right now to wear a mask, try and keep 6 feet away from other people. Down here, we say about the length of an alligator. But I'm not sure that means a whole lot to y'all. But nonetheless, 6 feet between you and the next person. And again, wear a mask, wash your hands regularly. And when you wash your hands, you want to do it for 20 seconds. And so 20 seconds is about the time it takes to sing happy birthday. So happy birthday to Mike, happy birthday to Mike, happy birthday, dear Michael, happy birthday to Mike, and many more. That's how long you wash your hands with soap and water, ideally hot soap. And that will protect you from getting it. And then let's see what else I had here. And I think that's it. Essential workers are still asked to show up. But again, try and observe those precautions.
And that's just it, Senator Cassidy. That's exactly what I was going to suggest with regard to the reasoning. These are essential jobs, and while we know that the employers have been and have been talking about how to make it as safe as possible, it's like the folks at the grocery store who are cashiering. Those are considered essential locations because people have to eat and they've got to go and they've got to get it. The same way here, you've got livestock that are being processed, creating the first part of that food chain, in the processing portion of it, and critical to making sure that we have food on the table for millions and millions of Americans. And so, you're going to find that at the government level, they're going to want to do what they can to assist those businesses to continue to remain open, even if there is a limited capacity because we need to spread folks out more than what they normally would be. But Joanna, thank you very much for calling in and bringing it to our attention. And, these are the types of things that help us to make the working conditions better. And hopefully we eliminate the possibility of getting those infections by talking about it. Thank you for calling in. Okay, once again, remember, if you've got a question, it's *3. And *3 will get you into one of my crew here, and we'll try to get to your question here yet this evening. Okay, I've got another one. This is from Deb, who is from Mitchell, and she's got a question on independent contracting as an independent contracting nurse. Deb, would you like to share your question with us? Deb?
Yes.
Hi, Deb.
Are you there?
Yes, I am. Go ahead, please. Yeah.
Yeah, I wondered if there were any provisions in the new bill that cover independent contractors when we can't work because of the COVID virus.
Deb, yes, there is. As a matter of fact, beginning this coming Friday, the day after tomorrow, you would be able to apply as an independent contractor. You would be able to apply as an independent contractor for a participation in the PPP, the Payroll Protection Act. And it's similar to a sole proprietor. You've got to bring in and show what you were making before. And if you're not making that now because you couldn't work because of the coronavirus and so forth, you are eligible for the PPP. So that would be good news, I hope, for you. And that would be separate from and in addition to the amount as an individual that you would receive directly from the Treasury as a grant. So this is the PPP, but you can't apply until after this Friday. And as an independent contractor, that word just came out today. So hopefully, Deb, wait, talk to your local lender, let them know that you want to get in line and that you understand you can't make application until this Friday. Okay? Thanks, Deb. Next call is from Jim. He is from Sioux Falls. Jim, go ahead.
Yeah, I was wondering how soon before you thought things got back to normal, of things opening back up, because Trump said he wants to open things with a bang. What does he mean by that? And how long do you...
Jim, I'm going to open this one up, and I'm going to take a shot at it, but then I'd like Senator Cassidy, who's here with me from Louisiana this evening, I'd love to hear his thoughts on it as well. I love the fact that President Trump is as optimistic as he is. I think he's trying to keep everybody's spirits up. I know as he says, he is optimistic. He wants to look for the best out there. And I would suspect that as we get closer to working this thing through, he's going to be trying to figure out a way to have celebration after celebration. A lot of what's going on here is going to depend on how soon we can start a decrease in the number of people that are actually catching this virus. And when we start seeing those hospitalizations go dramatically down and we don't have people catching it, then we'll know we're on the right track. We're planning in our government planning, we know that we're going to have to continue to help folks up through and into July. We basically know that. That's the reason why this CARES package that's been put together that is over $2 trillion in value was set up to go all the way until June 30th, is because we wanted to make sure that until then, folks knew that if they couldn't get back to work by then, that there was some relief in sight. So what we're saying is we're not in control of this virus yet. The virus is basically going to control part of it because we're going to have to wait and see what the facts bring out. But most certainly, it's not going to be in the next 2 weeks. I think it's going to be well into June. But most certainly, I think we should start to see things getting better, and we should be on the downward trend in this country in the next 2 to 3 weeks. That's my hope. Dr. Cassidy, what's your professional opinion?
I think it somewhat depends on how well people socially distance. If people are careful about doing it, then it's going to quickly kind of decrease its transmission. If folks just take it for granted and don't pay attention to the instructions, then we're going to continue to have more cases. Now, even once it goes down, we're probably going to have to learn to live with this, meaning that even when we begin to go out, if you're a diabetic or have high blood pressure, if you're significantly overweight, probably you're going to be wearing a mask and taking hand sanitizer in your pocket. So even if we kind of go back, and I would hope that it could be even before June, don't know that, but hopefully. But the critical thing is we have to learn to live with it afterwards and see until we get a vaccine And once we get a vaccine and can vaccinate everybody, that'll be, the game changer. But in the interim, we're going to have to figure out other ways by which to adapt. And if somebody's at higher risk, how to avoid becoming a casualty of this.
There you go. And, I think this is right down your alley as well. I've got Damon on the line, and he's got a question concerning the development of vaccines. Damon, you want to come on board and visit with us a little bit?
No, absolutely. That was a perfect dovetail. Senator Cassidy, thanks for your time tonight. This one's for the doc. I'm just curious on your perspective in regards to the development of a vaccine and the fast tracking that's been approved, and also more specifically on how the recent developments in a successful expression of the antigens and what that could mean to the development of an effective vaccine.
Hey, Damon, great question, man. Great questions. And I used to teach with LSU Medical School, so I'm going to put on my med school hat for just a second. What we're hearing is the vaccines will take at least 12 months, maybe as long as 18 months. So even though there's kind of safety trials being taking place now, I think optimistically it'll be here in 12 months. And certainly that's what Tony Fauci says. He says 12 to 18. Now, there is a possibility, though, that we can get something going before then. And you kind of alluded to it. When the best evidence now is that when somebody has coronavirus and clears it, they are then immune to the infection. Well, that would be fantastic. So, okay, I'm infected. I get over it. Maybe I didn't even know I was infected, but they do a blood test on me and it turns out I was. Now I'm immune. If I'm a nurse, a physician, a nurse's aide, I can now go into the room of a routine coronavirus patient not having to wear personal protective equipment because I'm immune. Similarly, if somebody's a bartender facing people all day long a foot away from them as they pour drinks, if they're immune, they can go back to work not fearing that they would infect someone or be infected by another. One thing I proposed is to build upon what we call, what we now have called immunization registries. Every state has an immunization registry. And so if a child's vaccinated at birth, then and then gets another set of vaccines at 11, and another at 15, another at 17, and then joins the military at age 30, that whole vaccine record's online. They can that's the case right now. And so if I join the military, say I was 30 years old, they can go back and see all my vaccinations. I hand them to them, boom, you're okay. We don't need to revaccinate you. So that is the current situation. I've suggested that we begin having an immunization registry. An immunity registry to coronavirus. If I know because of a blood test that I'm immune, put it in there. I go to my employer. Hey, listen, online, boom, I handed it to you. I'm immune. I don't need to wear personal protective equipment. I can face the public. By the way, as one of our earlier callers talked about our small town, what if the people, everybody in that town was immune? They just didn't know it. Well, by this immunity record, you would be able to know that they were all immune and nobody would have to wear personal protective equipment, mask, you name it, when they go to the grocery store. Life has returned to normal. So I do think we need to start documenting who is actually immune. It would make a big difference in the life of the individual, their business, but also our entire society.
Thank you very much for that question and for the answer. That makes a lot of sense here. See, I've got a former neighbor of mine from Pierre that now lives in Sioux Falls. Larry is on the line, and he's got a question for the doc. So, Larry, if you're there yet.
Yes, I am. Okay. Thank you, Senator. I have several health issues, and I have to go into a lab every 2 weeks to give blood to have it tested. And I was wondering, how do I protect myself from the other patients and the lab people besides wearing the mask and washing my hands afterwards? Is there anything else I can do? Because the idea of it is kind of frightening.
Yeah, so what I would do, again, wear your mask, bring your hand sanitizer, but when you sit down, I put little Lysol or Clorox wipes in a baggie. And when I go someplace that, for example, I have to go sit someplace where I don't normally, I pull one of those Lysol wipes out and I wipe everything down. I stand up until it dries and then I sit down. So if you're going to go to the office and sit, that would be the perfect place to do it. Someone asked earlier, how long does the virus last upon surfaces? On plastic, it can last 3 days. On stainless steel, it can last a couple of days. And so I'm assuming that the office is wiping things down, but unless they're wiping it down between everybody that sits there, you're at risk. Similarly, when I go through a door, I use a paper towel to open it. I try and bump it with my butt if I can to get it open. I wait till somebody else walks through and I hook it with my foot. Whatever I can do to stop it from touching that door, that's what I do. But then afterwards, if I do have to pull it open with my hand, that's when I use my hand sanitizer. So just be conscious of everything you're touching. I also, by the way, wear long pants and long shirts just because I figure I can go home and wash my clothes, but a little bit easier than if I'm wearing shorts. Down south, it's already warm. So we're wearing short sleeves and short pants. But when I go out, I try not to do so.
Well, Doc, thanks for answering Larry's question. Larry, we wish you the best. Hope everything's going good for you down there. And Doc, up here yesterday was short sleeves day, but today it's downright cold again in our state. I do have Mike from Custer out in the Black Hills on the line. And Mike, you've got a question for us. Fire away.
Hey, good evening. Yes.
Good evening.
COVID. Good evening. Thanks for doing this, by the way.
You bet.
This COVID pandemic, with all the rhetoric on TV, I got to hearing about globalization and the impacts of that on the supply of medicines and such regarded to this. And I also got to thinking about some other things with regard to imports and such. I got to thinking about beef, importing of beef, and how that's being processed. And I recently got some info from a friend back in Gregory County that talked about fenceposts.com has an article on importing of beef and the lack of country of origin narrative. And I thought, maybe it's time we stood up and said, we need to kind of take care of things with regard to imports of products and such. I think our beef producers need a little help so that we can have a little fair competition on this globalization environment that we're in. We need to know where our products are coming from.
Okay, hey Mike, thanks for the call and the comments. I think part of what you're talking about is the MCOOL, which is the mandatory country of origin labeling, which was declared illegal and against the World Trade Organization's guidelines back in 2015, I believe. I tell you what, I just sent a copy of the South Dakota Legislature's resolution asking the president to reconsider getting mandatory country of origin labeling back in as part of the trade negotiations with Canada and Mexico. If he's not able to get an agreement with them, they basically, under these guidelines, could impose well over $1 billion in tariffs on other types of ag products. That's the reason why so many of the other portions of the ag industry aren't really in favor of MCOOLs, because they're afraid of the tariffs that would be imposed on them. But nonetheless, what we've got here is we've got a serious issue with regard to what I consider to be advertising of beef products in the United States today. While I think, if the president could get MCOOL back into the negotiations, I think that'd be the best at this stage of the game, so that we really could have a mandatory country of origin labeling process. In the meantime, while that goes on, the Department of Ag right now in the United States actually has a voluntary program that lets processors, people that sell red beef or beef in a store, to put a little sticker on it that says product of the USA. And unfortunately, right now, people think that means that was from some South Dakota producer, or a producer at least from the United States, and that's not the case. It could be boxed beef coming in from any place else, from like 20-some different countries, And as long as it's repackaged by a processor in the United States, that product of the USA sticker is allowed to go on. And as a consumer, when I found that out, I was downright irritated because I always thought I was buying product that was right here in the United States, and it's not. And so now I've sent a letter, and matter of fact, we put together legislation saying we ought to make that very clear that it's got to be born, raised, fed, and processed in the United States to get that voluntary label of product of the USA on it. So, yeah, look, I agree with you. I think there's some things we can do, and these guys out here right now that are feeding cattle are just getting the snot kicked out of them in a market where you're seeing sky-high prices in the showcase, but you're seeing some of the lowest prices we've had in a long, long time when it's sold on the open market. And right now we've got 4 packers that make up about 80% of all the processing capabilities in the United States, and it doesn't seem to me that our current laws for antitrust and so forth are working right here. And so I've asked, I sent a letter along with some other folks. We sent a letter into the Attorney General asking him to review what's going on in this market and to make a decision. Either, number one, there's somebody that's not following the law the way that it's supposed to be followed, or number two, maybe these laws need to be revised because the current marketplace is wrong for our beef producers. And I guess I'm going on a little bit longer than what I planned, but Mike, thank you very much for bringing it up, and you're right. We not only have to be able to make sure we have a good food source here in the United States, we got to do the same thing with our pharmaceuticals. We got to do the same thing with other things that could come in short supply during an emergency. We're finding that out right now, and I guess this is a heads up for us to make some changes in the way we protect those critical assets in the future. But thanks, Mike. I appreciate your comments, and we'll be talking about that, I'm sure, in the future here as well. Now, I do have Paul from Isabel, South Dakota, way up in the northwest portion here. He's got a question about the CARES Act. Paul, you're on.
Well, thank you for doing this, Senator Rounds. I really appreciate this and very informative. I've got a question for each one of you. Number one, for you, Senator Rounds, how are we ever going to repay the $2 trillion, or what's the plan on repaying the $2 trillion that this is going to cost, for one thing? And the question I have for the doctor is, has any of this ever been related to animals? The COVID-19, is it carried by animals, or does anyone know yet? And thank you very much.
You bet, Paul. Hey, and thanks, Paul. Actually, it might be more fun for me to answer the animal one, and I'd make Senator Cassidy, answer the one on paying for this, but I wouldn't be fair tonight. So let me take a shot at the reason why we're spending this $2 trillion right now and worrying about paying for it later on. We've got about a $20 trillion economy in the United States today. We could see it going south, and we know that if we don't keep this economy as strong as we possibly can, and if we don't do for individuals what they can't do for themselves right now in this emergency situation, we'd have folks that, number one, would go without food. They probably would not be able to pay their rent, their mortgages, and so forth, and we would have a real meltdown in our economy, and we would not have enough of an economy even to support the existing $23 trillion debt that we've already got in this country. And so most of us looked at this and said, number one, we have to take emergency action here just as if we're in a war. And the most important part here is to get this economy to survive and to get a way to actually protect people from a very, very dangerous virus. And second of all, we recognize that right now, with the amount of money coming back into the United States, because our economy is stronger than the rest of the world, it's pushing a huge amount of dollars or a huge amount of assets in here, which means that the interest that we are paying right now is at literally record all-time low numbers. And we just decided that it was better to be able to maintain this economy and allow this economy to come out in a very rapid recovery, good for our citizens and good for our country, and give us a better chance of actually paying off the other $23 trillion eventually if we spend the $2 trillion up front right now, knowing that it's all going back into our economy, and at the same time taking care of people that literally have no place else to get this kind of a response from through no fault of their own. Not their fault to have this virus, and most certainly they're not going to be able to handle this on their own. So both a message of this is something that government does when individuals can't do it themselves. And second of all, long term for our economy, the quicker we get this economy rolling again, the better off our economy is going to be, and the better chance we have of paying off not just this, but other debt as well. Doc Cassidy, your thoughts?
Yeah, a couple things. It is thought that the virus came from bats through some odd mammal called a pangolin into human beings. Now it appears that the coronavirus was found in zoo animals in the Bronx. They checked tigers who suddenly developed a cough after having been exposed to a zoo worker with the coronavirus. And the tiger has of course you're wondering, who did the nasal swab on the tiger? Anyway, that just suddenly occurred to me. Who's going to stick a big long Q-tip of this tiger's nose? But that said, they found coronavirus in the tiger's nose. They have other animals there that likewise have a cough. It's unclear that the virus can spread back from the animal to a human being. So that's always the question. It went from pangolins to humans, but in the wet markets in China, there's a real intimate contact between humans and the animal. But now it has gone from humans back to another mammal. So I think that kind of leads to the broader issue, though. We've been speaking of an epidemic, meaning that the coronavirus has like epidermis on your skin, has come on top of our society. But from henceforth, we just have to be prepared. It is now going to be endemic, meaning that it is in society. And every year, we're going to have another wave of coronavirus until enough people have immunity and/or we've developed a vaccine. And so whether it's in animals or only humans, we're going to have to learn to live with coronavirus. And if we don't spread it to each other, maybe we get it from other mammals.
Hey, Doc, thank you. And I want to tell everybody I've really appreciated having Senator Bill Cassidy from Louisiana, as he calls himself a Cajun, on the line this evening. We're getting down to the last few minutes here. And once again, I want to say to Doc, thank you very much for taking time and participating with us up here in South Dakota. There was a question I wanted to get to yet, and I'm going to have to just ask the question myself. Some folks out in the Black Hills were wondering about what the plan is for tourism and so forth, and I could just tell you that there is a concern right now yet, because when we built the PPP portion of the CARES plan, we fully expected that small restaurants, bars, lounges, even those that had gaming casinos and so forth in them would all be eligible. The SBA put out an interim rule that says that they're not reading it that way. The president today indicated he was going to take a second look at it. We've sent a letter to the SBA telling them that they've interpreted this wrong and we want to get it corrected. We're going to continue to push to make sure that our Indian gaming casinos are going to be included, and also those folks out in the Black Hills that have the small casinos, particularly in Deadwood and around there as well. That may not answer all the question here, but we're working on it. We're going to try to bring this thing to an appropriate, responsive ending so that those folks can participate in the PPP as well. And we hope to get that correction made as soon as possible. And I apologize we couldn't get directly in and have John from out there in Spearfish be able to ask it directly. Doc Cassidy, thank you very, very much this evening for participating with us on this. And then for individuals that had questions, we had a lot more questions out there. If you would like, we've got basically information on where you've called in at, and we will try to make responses back to you to touch base. And if not, you can always come to our website, rounds.senate.gov, ask the question there, and we'll be happy to get back with you. We want to be able to help everybody participate as much as possible in this relief effort. And if there's something in particular or a concern that you've got that we can answer, we'll do our best to do so. We will try to have 2 more town halls next week as well, one during the day and one during the evening, hopefully to answer more questions specifically about how, as we roll out the CARES Act, what's working and what's not working. Once again, Doc, thank you very, very much for participating with us on this event tonight. And with that, I will close it out and ask everybody to remember that during this Holy Week, our Jewish community has begun celebrating Passover this evening with Thursday, Holy Thursday, Good Friday, and Easter all coming up. It never hurts to say that extra little prayer and thank the good Lord for everything good in our lives, and we're all going to make this thing through in one piece and celebrate when we're done. Have a good evening. Thank you.